Let's discuss about EKG localization of Stemi. First, we'll draw our standard heart. Right atrium, right ventricle, left atrium, and left ventricle. We have the tricuspid valve here and mitral valve here. Now let's get some different color. Let's say green. Okay. So what we have here is we have the SA node over here, the AV node over here, and then from here we have the bundle of His. BUH stands for bundle of His. And then on the right side we have the right bundle branch, and then on the left side we have the left bundle branch. Right bundle branch, left bundle branch. And from either of those we have tiny fibers on either sides. These are called Purkinje fibers. Purkinje fibers. Okay. All right, let's see. Next up we have, again we'll use a different color, red this time. Now we'll bring in some blood vessels here. Okay, so imagine that we have the aorta that's coming out of the left ventricle, and then from the aorta we have some branches. On the right side we have the right coronary artery, and then it continues on and becomes the right circumflex. We'll say RCX. And then on the left side we have left coronary artery, which continues on the lateral surface, and this is the left circumflex, LCX. And then the left coronary artery gives rise to left anterior descending as well, which goes all the way down over here. Okay. All right. So now let's put in our leads. So imagine if we have two kinds of leads. We have chest leads and we have limb leads. Chest leads are also called precordial leads. So this one is on the right side, the right shoulder usually. AVR on the right, AVL on the left, and AVF, F for feet. Right? And if we draw an imaginary line from AVR to AVL, we can call that Roman number 1. AVR to AVF, we can call it lead 2, and then AVL to AVF, we can call that lead 3. Okay. So these are the limb leads. Now let's label the chest leads, the ones that go directly on the chest. These are also called precordial leads. So with this one, what happens is we have V1 over here, somewhere around the SA node and right around the septum. We have the V2. V3 is right around AV node. V4 is right at the apex. And we have V5 and V6, closer to the axillary region. Okay. This is called the Anthovian triangle. And by knowing this triangle, by visualizing this triangle, whenever we come across a question which has mentioned EKG leads, patient has MI, or patient was found to have ST segment elevation in leads 2, 3 AVF or 1 AVL V5 V6. That piece of information is very, very important. And once you know this diagram, that piece of information becomes a lot more valid. Now, let's take a look at another diagram. This one right here. Taking a look at the lateral leads. So lateral leads are green, 1, AVL, V5, and V6. 1, AVL, V5, V6, right? So make a note that 1 is right over here, AVL is right over here, V5, V6 are over here. And imagine that there are cameras from AVL looking towards the heart, from lead 1 looking towards the heart, from V5, V6 looking towards the heart. And those areas are all looking at the lateral circumflex artery. Lateral circumflex artery. So what we can say is the lateral leads are looked at, or rather when they say lateral infarct location, right? The lateral circumflex artery is affected, and we can find that in 1 and AVL. 1 and AVL, right? So that's one way to pick those up. Inferior, 2, 3, and AVF. Inferior is 2, 3 AVF, leads 2, 3 AVF. 2, 3, and AVF. And again, imagine a camera looking from leads 2, AVF, and 3, looking at pretty much this area right over here, where you can see the cursor. Right? So this is all supplied by the RCA and the branches of RCA. Inferior, RCA, 2, 3, AVF. Yes. Let's take a look at anterior. We have V3 and V4, right? Now sometimes they can also describe as anteroseptal, involving V1, V2, V3, V4, or anterolateral, V3, V4, V5, V6. Or they'll just say, oh, they have anterior wall MI, V3, V4. So V3, V4 is right over here. This is considered anterior. V1 and V2, these are septal. V1 and V2 are septal. And then V5, V6 are lateral. Right? So depending on what leads they mention in the question, we can say it's either anterior, anteroseptal, or anterolateral. And the artery that supplies that area, anteroseptal is LAD, V1, V2. Anteroapical, so apex goes all the way down towards the bottom of the heart. It's still LAD, but sometimes in questions they say distal LAD, V3, V4. V3, V4. This is distal segment. This is proximal segment of LAD. So that's anteroapical. Anterolateral LAD or LCX, both are supplying those areas, V5 and V6. And the posterior, this is the only one that's left out. Posterior is, or the posterior area of the heart is supplied by the posterior descending artery, which is a branch of the right coronary artery. So this branch we can draw over here as a branch of RCA. So think of the dotted line as the PDA. So it goes all the way down on the back side of the heart. That's PDA. Not patent ductus arteriosus, but posterior descending artery, branch of RCA. These are less commonly tested on the boards, but good to know. PDA, which is a branch of RCA. And here you'll see V7 to V9 leads and ST depression in V1 to V3 with tall R waves. Now, one last thing that we can make a connection here is we added on this diagram are in green. If you look at the green ones, those are our conduction system, right? So if the RCA is affected, if the RCA is infarcted, it can potentially affect the SA node, right? If the left anterdescending artery is affected, it can potentially affect the right bundle branch or the left bundle. Mostly the left bundle branch. The right bundle branch would be mostly by branches of the RCA, right? So depending on the artery, you can also localize what part of the heart is affected, what part of the conduction system is affected. Right. And that is your EKG localization of STEMI.